it's Dr. Hannah with this week's Hot Topic. Today I want to talk to you about a question that we get probably more times than not, that people will come in and be like, hey, is this broken or did I just sprain it? So I'm going to give you a couple easy ways to see if you broke something or you sprained it, and then from there you can take that information whether you go to the ER, the orthopedist, or you can come here, and if it's a sprain we can certainly help you out with it. So the big three things that you want to kind of gauge of if it's broken or if it's sprained is pain, swelling, and if it looks deformed. It kind of seems kind of like a duh thing, but you'd be surprised what some people have come in showing us, be like, do you think this is broken? And yes, the answer is most definitely yes. So the big thing is pain. If you break your leg or your arm or something, most of the time you're gonna feel pain, but most of the time you're gonna feel numbness as well with that. So it's not just like that aching pain that you might feel with a sprain. Usually with a sprain, that pain also, like, it can be pretty intense. Like, some sprains are actually worse than breaks, but that pain is gonna be more like an ache or a sharp or anything, but you usually don't have numbness with a sprain, but with a break you usually do. So that's kind of the big thing. Do you have pain, or is it numbness and pain, or what? How do you describe the pain? The other thing, like I said, is kind of obvious, but does the bone look weird to you? Does it look like some little sticky thingy outie shouldn't be there? If it does, it's definitely broken. With sprains don't cause any bones to dislodge or anything like that. Obviously, if you can see the bone coming out of the skin, it's definitely broken. Not probably broken, but just go to the emergency room. So that is also another good indicator of, hey, is this broken versus if it's sprained, it just looks kind of gnarly. The other thing is, what kind of noise did it make whenever you injured yourself? Did it make a popping sound, or did it make a cracking sound? A popping sound, a lot of people will run and they're like, oh no, I heard a pop in my ankle. That's usually just a sprain. So breaks normally don't make a popping sound. It's not that they don't, but usually it's just a sprain when you hear a popping sound. If you break something, you're gonna hear a crack because the bone's actually cracking. Sometimes, not always. Again, you can have a very small fracture and most people don't even know it. So that's something else that you wanna keep in mind. The other thing that's kind of a good indicator is, where is the pain located? So if you have pain directly on the bone when you push it, or someone else pushes it, it's probably broken. So that's kind of a good rule of thumb. They do this in the hospital too. It depends on where the pain is. If you have pain that's in the surrounding area, like your joint or your joints, not the joints I mean, but like more of the muscle and the tendons and ligaments just around the bone, then that's most likely a sprain, not necessarily a break. You can't necessarily tell just by the bruising, because you can have some pretty bad bruising from a sprain versus a break. You definitely will have more bruising with a break, but again, just because there's bruising or there's not bruising doesn't mean that you sprained it or you broke it. So that one's not really a good indicator of if it's broken or if it's sprained, because again, it's just, there's damage in general, either when you sprain it or you break it. So bruising is not really a good way to check to see if you broke something or not broke, if you sprained it or whatever. The last thing is, if you break your ankle or your leg or something, can you walk on it immediately after the injury? Most of the time, if you have a sprain, you can walk on it, you can kind of walk it off a little bit. It might hurt. If you have a really bad sprain, there might be some ligament damage, so you might not necessarily be able to, but at that point, that's not something that you should just leave alone anyway. So that's another good indicator. Can you walk on it right after the injury happened? Most of the time, if you have a break, you probably can't. So hopefully these little things to see if it's, hey, if this is a sprain or it's a break, will help you decide one way or the other of where to go. So hopefully you don't come in here with a broken something. You want us to check out that it's been broken for a long period of time. That would be bad. So hopefully you can take this with a grain of salt. Again, if anything that you're super concerned about or whatever, just make sure you go to the ER, prompt care, get it checked out. It's better to get it checked out rather than wait and make it a problem worse for you later. That's all I have for you this week. We'll see you guys next time.